Dr. Tam, I'm interested in your views on infection-acquired immunity. The immunologists I've spoken to and the data that I've reviewed seems to show that there's at least some evidence that the durability and strength of infection-acquired immunity can rival, if not exceed, the immunization of vaccination, particularly from mRNA vaccines.
And I wonder, and I'm asking you this question, whether we ought to start to be looking at changing direction. We've whipped the public health horse about as hard as we can whip it.
About time you pencil dick showed up.
Thank you, and I just feel obligated to state for the record, there is no coalition government in Canada. There is a confidence and supply agreement between the Democrats and the Liberals. Just for anybody interested in accuracy. Dr. Tam, I'm interested in your views on infection-acquired immunity. The immunologists I've spoken to and the data that I've reviewed. How clear is the data regarding its strength and durability, and how does it compare to vaccine-acquired immunity?
So vaccines are trying to, it's actually the gold standard as far as when we recognize the immunity you get from infection, that's what vaccines are trying to mimic.
Seems to show that there's at least some evidence that the durability and strength of infection-acquired immunity can rival, if not exceed, in some cases, immunization, or I'm sorry, the immunization of vaccination, particularly from mRNA vaccines. I'd like to hear your views on that, and maybe ask why Canadian health policy doesn't recognize in any way the impact of infection-acquired immunity.
Well, I think we're just learning about immunity both from infections and from vaccines. I think it also depends on the variant that you're talking about. I think there's certainly evidence that variants prior to Omicron, if you had an infection, you could have quite significant immunity. That has to be monitored in terms of how long that immunity lasts for and the quality of that immune response. But when Omicron arrived, it was a game changer. And there's many things about Omicron that's a bit different. It can cause a milder illness, maybe only infect your respiratory tract before your body gets into work to fighting it. And that the immunity to Omicron variants might be quite variable. So we're still learning about that. But what is important is that we have to understand what we call hybrid immunity as well. And in some of the studies, and they're quite sparse at the moment, it shows that if you're unvaccinated and you got infected, you're more likely to get reinfected with Omicron. If you got vaccinated and you got infected, you're less likely. Your body generates more neutralizing antibodies, perhaps, but those questions remain. So I think it is not a simple question. It may be dependent on the variant as well.
Is questions as to when we are going to see mask and vaccine mandates for the federally regulated sectors removed. And I know we've had many people ask questions about what the targets are, but I'm wondering what you think I should be telling my constituents when they call and ask those questions.
Mr. Chair, as I mentioned earlier, for the federal vaccine mandate, it is for example, the Treasury Board of Canada, which is responsible for the policy on the vaccination, for example, for public service. And again, all the elements of the policy and other aspects of the public health aspects are being reviewed by them. And this is all based on science and advice.
And so, that's fantastic for the public servants. But for myself, and in my riding, being a northern riding, we basically have to fly to get just about anywhere. So there are requirements by the federal government and PHAC that require proof of vaccination for people. If they want to go to a funeral in Toronto, if they're not vaccinated, they can't go. And so they're really curious to know when you guys are going to update this, because no other allied country is requiring people to be vaccinated to travel within their own country. So are there any targets in place for that?
So, Mr. Chair, what I can say is that we are continuously evaluating what is the epidemiology, what is the vaccination coverage, and what other public health layers can provide the protection. And this is an active conversation which we're having in terms of the public health advice as we move forward, so that a particularly a science-based decision can be made on that.
Would it be in the interest of PHAC, would you submit a decision tree with who would make decisions in the Public Health Agency of Canada? We've had some difficulty understanding who makes the decision, and if you would submit that in a simple form, that would be excellent. And secondly, would it be fair to say that it's the Prime Minister who makes the final decision with respect to federal mandates? Simple yes or no answer, ma'am.
There'll be a cabinet decision.
Cabinet decision, right, okay, fair enough. Simple yes or no. Can we see the benchmarks, the metrics that you use? They cannot be that complicated. Just send me the ones on federal employee mandates who can return to work without being immunized. Does that exist, and can we have it?
My simple answer is that we do take a number of factors into consideration, Mr.
Right,
Chair.
so tell me what they are, and please give me the list of them. That's all I'm asking. You know what they are because you use them, so I would like to see them on behalf of Canadians who, as Dr. Tam said, are lacking trust and have gained complacency. So could you please give me the list of benchmarks that you're using? You have them. I know you do. You just said you did. Could we have them here at committee, please? Simple.
We would take that as a remittance, Mr. Chair.
I'm not sure what that means. Is that a yes or no?
We will attempt to put that all together for your consideration in a written format, Mr. Chair.
You will table that in writing to this committee.
Yes, Mr. Chair.
Why, thank you very much. Wow, that was just lovely. I really appreciate that. I've got no time left, so thank you, Mr. Chair.
Yeah, but you got what you were looking for, Dr. Ellis, so thank you for that.
Canadian people have done very well. We've had a third of the death rate of the United States, about half the death rate of countries like France and Italy, Germany, using those public health measures. But I think it's come at a cost. It's certainly come at a cost in terms of the national debt. It's come at a cost in terms of mental health. It's come at a cost in terms of civil strife. And I wonder, and I'm asking you this question, whether we ought to start to be looking at changing direction. We've whipped the public health horse about as hard as we can whip it. Maybe we have to start changing a direction in terms of trying to place measures to prevent people getting really sick. And that means protecting the elderly with third doses or fourth doses of vaccines if necessary. And the other thing is possibly doing better in terms of treatment. So we do have pretty good treatments in terms of Paxlovid, in terms of remdesivir for treatment, which really aren't being used that much. The public largely doesn't know about them, and people don't know if you're high risk and you get sick, perhaps you should get treatment. So, and maybe we've come for full circle. So normally, yes, public health is cheaper and a better way of addressing a problem, but perhaps we're starting to look at maybe treatment is perhaps starting to become almost a cheaper thing to do. So I'd like to ask your opinion about that. Should we be doing more in terms of treatment, protecting the really vulnerable, and worrying maybe a little less about the costly public health measures?
Thank you for that question, Mr. Chair. So I think at this period, 2+ years into the pandemic, with vaccine in hand, even though we're still learning about it, I think there's a much better chance of getting that balance. And that's what the chief medical officers across the country are trying to do. You're trying to balance the impact of the pandemic, but also try to reduce the negative impacts of some of those measures. And I think the easing of those public health measures is occurring across the country with the view that unless it's really, really necessary, you're going to rely on the least restrictive of those public health measures like mask wearing, etc., in order to reduce the impact. But treatments do play a role in reducing severe outcomes and preventing those with the highest risk who may not respond as well to vaccines. So it is a complementary measure, but vaccines still remain, I think, as a preventive tool, one of the most important aspects of our ongoing management of COVID-19.
So I take it from what you're saying that you do believe that the treatments are important. Do you have any comment as to how, whether we're using them as effectively as we could be? And that certainly my experience for someone who still does occasionally clinical medicine is that the vast majority of people don't seem to know about them, and certainly accessing them has not been very easy.
Yes, I think the broader health system is learning how to do implementation. Of course, from the federal perspective, we have done our leadership work in procuring the vaccine and leveraging partners to provide guidance on how to best use the medication. But implementation is not easy because you have to get the medication into people really fast and someone has to get a diagnosis. So, but we're seeing innovation across the country. You've heard about Quebec getting it through pharmacists being able to prescribe. Other provinces are making sure that the physicians who look after the highest risk, for example, people who have certain types of cancers and other chronic medical conditions, know how to access those medications. And I've been encouraging members of the public who are at higher risk to find out at the local level how they can access that medication ahead of time before they need it.